Personality disorders, and I'm going to do it in English, if that's okay. Yes? I thought that I was asked to talk about the psychopathology within personality disorders. It's a very interesting field, and especially the place at the hospital where I work at is highly relevant. There's a lot of patients diagnosed with personality disorders in the hospital. So I thought I would start with explaining what is a personality trait and what is a personality disorder. So a trait, traits are distinguishing qualities or characteristics. So for example, like excitement seeking, how much self-discipline you have, if you're impulsive, if you're a very calm person. These are the types of things that constitutes a trait. And people are very different on this aspect, and there's very different variables or dimensions to this factor. Yeah. And a personality disorder is an enduring pattern of inner experience and behavior that deviates significantly from the expectations of the culture of the individual who exhibits these patterns. So it can be manifested in one or two ways, or two or more ways. So for example, people with personality disorders see the world in a different way. They perceive things, they interpret things in a different manner than the average person would. And their emotional life or emotional range is quite different from most people. It has a lot of intensity, it varies in appropriateness, and it just deviates from what is normal, from how you and I or just like regular people would react. They also differ in how they function in interpersonal dimensions, so how they interact with other people, so in different social groups. They also differ in how they master their impulse control, and people with personality disorders, on average, are seen as inflexible and pervasive, and they are in this manner across many situations. Personality disorder is associated with considerable personal and social disruption. And the personality traits and the disorder is quite stable. It has a long duration, and it can be traced back to adolescence or into childhood. So what this means is that in order to receive a personality disorder, you have to have these traits and this type of functioning since you were a young teen or from childhood. So this is a pervasive, long-lasting trait or disorder. So it's chronic. And the pattern is stable, and it's thought that the behavior is egosyntonic, and what this means is that it's perceived to be appropriate by that individual. So they do not experience themselves different from other people, and they have reduced ability to take in the stance of other people. And personality disorders are they're in different clusters. So the first cluster is cluster A, which is the odd personality disorders. Cluster B is the dramatic and emotional, and cluster C is the anxious type. And this is according to the personality disorders that are mentioned in the diagnostic manual. So this is what we look at when we're trying to diagnose patients. So cluster A consists of three types of personality disorders. The first one is the paranoid personality disorder. The second one is the schizoid, and the third one is the schizotypal. A paranoid personality disorder, and the second one is the schizoid personality disorder. And this is quite an odd type. They're usually detached from their social environments, which means that they're alone, they don't really function in groups, they don't have a lot of friends, they only have close relationships with their own family members, and they have quite a restricted emotional expression. The schizotypal, also quite similar to the schizoid, they lack close relationships, and they have quite odd perceptions of how the world functions and how society is viewed, and they also exhibit quite odd behavior. So let's go a little bit more in depth into the different personality disorders in cluster A. The paranoid personality disorder, they have a global mistrust, and they are quite suspicious of other people. So they believe that others are using, lying to, or harming them without any concrete evidence. So they are just inherently quite distrusting and extremely suspicious of other people. And this suspicion is so disruptive in their lives that it disrupts all areas of their social functioning. So what this means is that they doubt the loyalty and trustworthiness of other people. They have a belief that their confidence will be betrayed. And if you try to come with any objective evidence to sort of state against this, they won't believe it. They believe that their reputation or character is being attacked by others, and they feel like they have to respond in some type of way. Most often they can be jealous or suspicious without cause, and they can exhibit these traits in intimate partners and accused of the other partner, for example, of being unfaithful. And the above symptoms are not active during a psychotic episode. So these traits can also be relevant in other psychotic disorders. However, a personality disorder is something that you have throughout your entire life. So this is something that you develop when you're young. In contrast to a psychotic disorder, which you also can develop in young age, but psychotic disorders also have the additional symptoms of auditory hallucinations, which means that you can hear things that other people can't hear, or that you see things that other people cannot hear. But people with paranoid personality disorder can also exhibit delusions and severe malformity in how they think, just in everyday life. And the second one, the schizotypal personality disorder. This is a pattern of social and interpersonal deficits marked by acute discomfort and reduced capacity for close relationships. So this means that they are unable or severely impaired in making social connections with other people. They have very odd beliefs. They can think in what is known in psychology as magical thinking. And this is, for example, thinking in or believing in superstitions or having telepathy, or having like a sixth sense, thinking that you can understand what other people are thinking or feeling in various situations without any concrete evidence for this. They experience themselves an unusual perceptual experience, so they might experience different perceptions where they think that somebody is touching them, but there's nobody around. They might have like these type of odd experiences. And I can come with an example from my work. Someone with schizotypal personality disorder, where they think that they're being drawn into a different realm, for example, and they struggle with distinguishing what is real and what is not real. However, they're borderline in a psychotic episode, but it's not a psychotic episode. They're quite good functioning. And it's just these types of things that sort of constitutes the schizotypal personality disorder. They're very suspicious, and they might exhibit inappropriate or constricted emotions. Their behavior or appearance is odd, eccentric, or peculiar. So someone with this disorder, you can sort of tell that there's something quite abnormal with them, with how they dress and how they present themselves. It's very apparent. They don't have any close friends or close interpersonal relationships other than family members. And they have also excessive social anxiety that doesn't really diminish with time being spent with other people. So no matter how much time they spend with other people, they do not seem to be able to rid themselves of this social anxiety. And the schizoid personality disorder, the third one in the group A, they experience a detachment from social relationships, and they have a restricted range of expressions of emotions in those relationships. So they don't really exhibit any desires. They don't enjoy close relationships. They're almost always solitary. They spend a lot of time on their own. They don't really seem interested in making any social interactions or social relationships. They're pretty much solitary. They have little, if any, interest in having sexual experiences with another person. They take pleasure in very few activities. They have very few friends. They don't really respond to praise or criticism of others. And they sort of display a certain emotional coldness and detachment, and their emotional life is quite flat. So they don't have any fluctuations in their emotions. They're always sort of very stable and just neutral. And this is the second group, cluster B. And this is where some of the more exciting personality disorders come into play. That's what I think anyways. The antisocial, the borderline, the histrionic, and the narcissistic personality disorders are in this group cluster. Antisocial is when you have a disregard and you violate the rights of others. Borderline is when you have a severe instability in relationships, in your self-image, and in your emotional life. And they also have an extreme level of impulsivity. Histrionic personality disorder, where they exhibit excessive emotionality. So I remember one of my professors came with an example is like the typical Hollywood actress type, where they are extremely emotional and they're very expressive, and they love attention. The narcissistic personality disorder. This personality disorder, this constitutes a lot of need for admiration, so they need people to like them, to praise them. They are grandiose, which means that they have an inflated sense of self. This means that they believe that they are the best in the world in everything that they do, and they overestimate and over-evaluate themselves in a positive regard. So, for example, if someone is an average football player, someone with a personality disorder, which is narcissistic, will sort of praise themselves into being, the next, some great football player. They have a lack of empathy, and now we'll go more deeply into the different types of personality disorders. And this is the antisocial personality disorder. This group has a very high occurrence in the prison populations. They have a high disregard for other people. They violate the rights of others, and in order to receive the antisocial personality disorder, the individual has to be at least 18 years old, and you have to have a evidence of conduct disorder from when you were young. So if a child has symptoms of antisocial personality disorder, they will start out with the diagnosis of conduct disorder, which is basically the same disorder, and it has to be set before the age of 15. People with antisocial personality disorder, they fail to conform to social norms with respect to lawful behavior. So they violate a lot of laws. So they might steal, they might attack other people, stuff like that. They're considered deceitful. They lie, use multiple aliases. They con others for personal profit or for personal pleasure. They have a high regard of impulsivity, and they fail to plan ahead. So this is why a lot of inmates, for example, classify for the diagnostic requirements for antisocial personality disorder because they have a high rate of impulsivity, which sort of fails to plan for not getting caught when they do these unlawful things. They have a high level of irritability. They are aggressive. They might engage in repeated physical fights or assaults. They have a reckless disregard for safety of themselves and for others. They're consistently irresponsible, and they have a lack of remorse. Borderline personality disorder. This is a disorder that I see a lot in the clinic, and this constitutes a very high degree of instability in their interpersonal relationships, and interpersonal relationships meaning relationships they have with other people. They have a very fractured self-image and a very fractured emotional life, and they are highly impulsive. So they might make frantic efforts to avoid real or imagined abandonment. This is one of the main criteria for this in order to receive this borderline personality disorder diagnosis, because they have a very weak sense of self, and the underlying assumption that they have is that they avoid real or imagined abandonment, and they do all of these things in order to avoid this abandonment. So they have a lot of unstable and very intense relationships with others, where they might idealize and de-evaluate. Idealization is when you think of a person as highly admirable, and you just think that this person is very perfect, they're amazing. And in the second instance, they will de-evaluate, which means that, for example, if you go into a relationship with someone with borderline personality disorder, in the first few weeks, you will experience that this person does everything for you, you feel like you are the best person ever, and then in the coming weeks, a process will start where they constantly de-evaluate you, which means that you go from like the highest of the highs to the lowest low. And they have issues with identity disturbances, and they have a very unstable sense of self. They are impulsive in areas that are potentially self-damaging, so they spend a lot of money, might go into substance abuse, reckless driving, binge eating, or self-mutilating behavior. Quite typical for this personality disorder is that they have recurrent suicidal behaviors and a lot of self-mutilating behavior connected to this. And they have an incredibly unstable emotional life, so it fluctuates extremely. So from 1 minute they might be very happy, and then to the next minute they might be in the lowest low, which means that they might start violently crying, they might self-mutilate, and everything is very dramatic and very unstable. And also quite important for this borderline personality disorder is that they have a chronic feeling of emptiness. Histrionic personality disorder, and this is the Hollywood type, and where they have excessive emotionality and where they are extremely attention-seeking. So they are uncomfortable in situations where they are not the center of attention. They might exhibit inappropriate, sexually seductive or provocative behavior. They have an extremely shallow expression of emotions, and what this means is that there's no depth when you come into contact with this type of personality. Extremely shallow, only talking about like surface level areas or topics. And they have a style of speech that is excessively impressionistic or very lacking in detail. They're very theatrical and exaggerated, and all of the emotions are very exaggerated. They're quite suggestible, so they are easily influenced by other people. The narcissistic personality disorder. That little picture on the right hand side is very illustrative of how they view themselves. And they have a pattern of grandiosity. So either in fantasy or in their behavior, where they think that they have an inflated sense of self, which means that they over-evaluate how important, how good they are in whatever they're doing. And they have a strong need for admiration, and they lack empathy. A grandiose sense of self-importance, so they exaggerate their achievements, their talents, and they expect to be recognized as superior to other people. They are preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. And they believe that they are special and unique, and that they can only be understood by other special or high-status people. They require excessive admiration. They have a strong sense of entitlement. So this means that they have unreasonable expectations, and they expect to be treated in a special way. They exploit their closest relationships. They take advantage of other people to achieve their own dreams. They lack empathy. They're unwilling to recognize or to identify with the feelings of other people. They are envious of other people, and they often believe that other people are envious of themselves. So they're quite arrogant. They might display haughty behaviors or attitudes. And now over to the cluster C group, where the avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorders lie. The avoidant personality disorder means that they are socially inhibited, so that means that they are scared of being vulnerable in front of other people. They have feelings of inadequacy, and they are very sensitive to any cues or signals that might signify that other people don't like them, don't approve of them. So they seek to avoid any sort of social interaction. Dependent personality disorder. This means that they are completely dependent on other people in every aspect of their lives. They thrive when other people are making the decisions for them. Obsessive-compulsive disorder means that you have a preoccupation with orderliness, perfectionism, and control. So the avoidant personality disorder, they have a pattern of social inhibition. So it means that they're afraid of social situations, so they inhibit themselves, so they stop themselves from going into larger social groups or just going to class, going to social functions. They have a high sense of inadequacy, and they are hypersensitive to negative evaluations, which means that they are highly sensitive to any sort of negative critique, remark, any sort of situation where they might be interpreted in a negative way, they avoid. So they might avoid activities that involve contact with a lot of people or large groups. They are unwilling to get involved with people. unless they are certain that they are going to be liked. They show quite strong restraint in initiating intimate relationships with other people. So these people are quite often quite solitary and only have 1 or 2 close friends, and will not really socialize in a high degree. They view themselves as socially inadequate, personally unappealing, or that they think that they are inferior to other people in some way. And they are unusually reluctant to take any personal risk in trying out any new activities. So they won't really try any new sports. They won't try making new friends. They will stick to the same people that they've known for their whole lives. And they will continue to do that. Dependent personality disorder, a bit similar to the avoidance, but the difference here is that they have an excessive need to be taking care of other people. So they need another individual to take care of all of their needs and functions, and they need another individual to sort of guide them into everyday life. So they have extreme difficulty making ordinary decisions by themselves. They need a lot of advice and a lot of reassurance from other people. They have difficulty expressing when they disagree with other people. It's difficult for them to initiate projects or do things by themselves. They have no self-confidence. And they go to excessive lengths to get or receive support from other people. They might often volunteer to do things that they're not comfortable with doing because of this. They feel incredibly uncomfortable or helpless when they are alone. And they have an unrealistic preoccupation of being left to take care of themselves, of himself or herself. So they are extremely afraid, and also cannot really deal with being by themselves or making decisions by themselves. So they always need a second party to help them. The obsessive compulsive personality disorder is a disorder where you have an extreme preoccupation with orderliness, perfectionism, and mental and interpersonal control. And this goes over your ability to function in normal everyday life. So for instance, they might be extremely preoccupied with details, rules, lists. They're extremely perfectionistic, and this perfectionism will interfere with ordinary everyday tasks. They are excessively devoted to work and productivity. They are reluctant to delegate tasks. They adopt a miserly spending style toward themselves, so money is viewed as something to be hoarded for the future. They don't spend any money on normal everyday things. They show an extreme rigidity and stubbornness. Rigidity meaning that they are extremely unflexible. So they cannot really alter in a very fluid way. So if you, let's just say that you want to, instead of putting the table in this manner, you come with the idea that you want to do it in a completely different way. You want to flip the table and then put the chairs in 2 different ways. This will be extremely difficult for someone with obsessive compulsive disorder. They will not really be able to do this. Multiple personality disorder. This is now known as a dissociative disorder. So this is a disorder that is quite rare, almost not really heavily used in the clinic. So this is a presence of 2 or more distinct identities or personalities within one individual. So this means that, for example, if you are a person and you have two different personality types within you that do not really communicate with each other. So the different personality types within you doesn't really communicate, so you might not be aware that there's, all of these different personality types functioning within you simultaneously. And this is quite ordinary in people who have experienced extreme trauma, usually sexual abuse. And at least two of these identities or personalities can take control of the other person's behavior. So they have an inability, so they cannot remember important personal information. They're quite forgetful. And in children, the symptoms are not due to imagination or fantasy playmates or stuff like that. This is a distinct disorder which is quite prevalent in trauma survivors, especially sexual abuse survivors. Although it's quite rare in psychiatry nowadays. Yeah, and also I just wanted to add that usually it is thought in psychology that personality disorders are developed during the early stages of your life, so from ages from 0 to 3. It is believed that if you do not have, if you are not really able to move in different developmental stages within this age group, you might be more vulnerable in terms of developing a personality disorder or any type of mental disorder. So what this means is that the quality of the interaction from your primary caregiver, usually the mother, directly affects how the child will develop in terms of personality. And what does this mean? It means that if you are not sensitive or responsive or warm enough in this critical stage of your life, so from ages 0 to 3, you might have what is called an arrest or a sort of stop in the development, which later shows as a personality disorder. So what is very important in this stage is the attachment to your caregivers, so your mother and your father, and also the social development of the child, and also the language and cognitive development and the emotional regulation of the child. So in developmental psychology, so the psychology of how people develop from infancy to adulthood, there is usually thought of 3 attachment types. There's a secure attachment, insecure avoidant attachment, and insecure ambivalent or resistant type. And the third type is closely linked to the disorganized attachment. So a securely attached child will cry when the primary caregiver leaves the room. An insecure avoidant will be a bit slower in this reaction, while the disorganized type will not really have any sort of emotional reaction if the parent leaves. So let's say there's a baby. The baby is 1 year old, and the mother is playing with the baby in a room, and the mother decides to leave the room. Most children who are securely attached will start crying immediately as the mother leaves, but when the mother returns, they will be very happy and they will stop crying immediately. If you are insecurely attached, you will be very hard to soothe. So when the mother leaves the room, you will cry, but when the mother returns, you will also start crying and you will not stop crying. However, if you have a disorganized attachment, you will have a very chaotic response to your primary caregiver leaving, because this child most likely is raised in a very chaotic environment where the primary caregiver is not readily available or not really attuned or observant or warm towards the child's needs. So when the child cries, there is nobody there, but sometimes the child will be comforted. And this will cause a reaction in the child to be disorganized, so they will not cry. When the parent returns to the room, but they might react in other ways. They might start hitting or might display negative behaviors. Yeah. So what this means is that the parents' relationship plays a much more influential role than the infant shaping the relationship with the parents. This means that the parents' influence in how the relationship is with the child is mostly determined by the parents' interaction with the baby. So, if a mother suffers from mental illness or engages in what we call here disturbed caregiving behavior, their children cannot compensate for this because it's an infant. They don't have any mechanism or regulatory alternatives to sort of react or to counter-react to this. So when the children are impaired, sort of damaged or influenced by this negative behavior, their mothers are generally capable of sort of making up for this. And this is known as sort of repairing the relationship. So if something happens, if the child injures itself, the parent is usually able to soothe the child. But if the child is not soothed regularly in these types of situations, then the disorganized attachment might occur, and this later lays the foundation for a personality disorder or attachment disorder. Yeah, and that was what I had to say about personality disorder. So this was just a very brief introduction to personality disorders. Yeah.
Thank you, Lydia. But I would like to ask you to summarize what I've been talking shortly in Norwegian, because there might be some people who don't understand English.
Okay. Yes.
5 minutes or so.
Ja. Personlighetsforstyrrelser blir sett på eller personlighetsforstyrrelse nå ble det litt vanskelig å bytte fra engelsk til norsk, en psykiatrisk lidelse av en gruppe forstyrrelser som blir som grupperes innenfor cluster A, B og C, og dette de forskjellige personlighetsforstyrrelsene som finnes. Men innenfor psykiatri så finnes det jo mange flere lidelser, men dette da personlighetsforstyrrelser. Og personlighetsforstyrrelser da tenkt til å være en livslang forstyrrelse hvis man ikke får hjelp for dette tidlig. Og personlighet, det blir kronifisert, eller det blir fullstendig utviklet når man ungdom. Så fra alder 17 til 18 så regnes det som at personligheten din fullstendig ferdig utviklet. Så det derfor det veldig viktig med attachment theory, fordi hvordan du har vokst opp og hvilket miljø du har vokst opp i, og hvor følsomme eller ufølsomme foreldre man har hatt, det kan ha betydning på hvordan man utvikler seg i senere tid, som kan gjøre deg mer sårbar eller ikke sårbar for å utvikle en personlighetsforstyrrelse for eksempel. Men innenfor personlighetsforstyrrelser så det også tenkt at det genetiske faktorer. Det betyr at det noen personlighetsforstyrrelser som går i arv. For eksempel antisosial adferd tenkt å være genetisk, så det betyr at hvis du har hatt noen i din familie som har antisosial atferdsforstyrrelse og fått den diagnosen, så det mer sannsynlig at det noen andre I familien senere som vil få denne lidelsen. Hvorfor vet man ikke helt, man litt usikker på hva det kommer av. Ja, så finnes det cirka 10 personlighetsforstyrrelser, og disse forstyrrelsene går mer på hvordan man reagerer på verden, og hvordan man tolker ting I sitt eget hode, og hvordan man klarer å relatere til andre mennesker. Og det som skiller vanlig personlighetstrekk versus personlighetsforstyrrelse som en diagnose, at det må gå utover din funksjonsevne, din evne til å fungere I hverdagen, din evne til å fungere blant andre mennesker. Det de største indikatorene på at man skal få eller ikke få en diagnose. Ja, jeg tror det var alt. Takk.
يقنينا هزينا مسجل هجنا يحطهم ملسن جزي خوي لذي مدرخنا بهمي إلكم حافنا بالكم كحاتو تخليهم مالتي يعني حتوزلو ويري توزلو